There you go.
Hi, I'm Dr. McKee, and this is
Dr. Gavaltovich.
And we're chiropractors at Goodyear Health Center. We're starting a series, it's called the Joint by Joint series. It's going over each joint of the musculoskeletal system, and we're going to highlight the history and assessment that allows us to determine what type of treatment a patient needs. So we're starting with the shoulder, so this one's going to be a shoulder exam. And this is our patient, the doctor here. And I'll show you an assessment that I use in order to classify or determine what the patient's condition is. Along with the assessment, we also utilize imaging if necessary. So we utilize X-ray and MRI if a patient needs those types of diagnostics. So for the shoulder, I get a detailed history from Dr. G, asking her when she feels pain, how often she feels pain, types of movement that causes her pain, and more questions obviously, but we won't go into detail there. For the examination, I'm going to have Dr. G have her flex her arm as high as she can, and she's going to ask me if she's going to tell me if she feels any pain with any of this movement.
I feel a little pain right in here, like a pulling, stretching.
Okay, so I'm going to use that information to determine her condition. I'm going to have her abduct her shoulder as far as she can and get from her if there's any pain.
That same pulling sensation.
I'm going to have her extend her arm as far back as possible.
Same pulling sensation.
I'm going to have her reach behind her back like so. And then come down. And then lastly, I'm going to have her go across her chest.
No pain. So
it's all types of movement of the shoulder, testing the joint, and if there's any end range pain or any pain during movement during that. I'm also going to look at resisted testing. So she's going to do the same movements with resistance, and I'm going to find out if she feels any pain throughout the motion. Nothing.
A little bit of that pulling sensation up there.
Come out to this side.
Same pulling right there.
Okay. Behind the back.
Nothing.
And then reach back.
That pulling.
So what we're looking at is the different behavior of the shoulder. If she's feeling more resisted type of pain in certain arcs of movement, and it's consistent, she feels it every time, that's usually indicative of a soft tissue related issue, impingement, rotator cuff strains, sprains, tears. So those types of things are going to allow us to determine, hey, is this soft tissue or joint related, which is going to guide our treatment, because we're going to do more soft tissue related treatment if it is a soft tissue related condition. Joint types of issues, which can be glenohumeral tears in the joint capsule. You can have bicipital tendon tears, strains, overuse. You can overutilize a joint to a point where you have mechanical pain or pain in the joint. That pain is usually variable, so you feel it some days and sometimes, but not others. And it usually, you feel pain in just certain motions, but it's not always there. For that, we're going to utilize more joint type of care. So we're going to do more manipulation, mobilization, and repetitive joint movements for the patient. We're going to utilize our whole care team. Goodyear Chiropractic is a multidisciplinary center, so we're going to utilize massage therapy, athletic training, physical therapy, as well as chiropractic, so that the patient gets the best care possible. So we're going to coordinate that based on our assessment and our detailed history, and any other future diagnostics we might need for the patient. So that's our joint by joint. On the shoulder, we're going to do this weekly and go through each joint individually and talk about care and the assessment. Thank you.
All right, bye.